West Africa is on high alert for the Ebola virus. The outbreak has killed more than 900 people in 4 countries, and experts say it might be months before it's over. The outbreak has hit in border areas of Guinea, Sierra Leone, Liberia, and also Nigeria. The first outbreak of Ebola in West Africa is turning out to be the worst outbreak of the disease ever. And joining me now for more on this is our VOA health reporter, Carol Pearson. And Carol, you know, the Ebola virus was not really all that well known before the outbreak hit. So do we know why it's sort of spreading so much this time?
Well, there's no probably one reason that you can point to. There are probably a lot of different factors, but their travel is more frequent now. Roads are better. And usually when you have a virus like this, you have international health workers who come in, contain it, and it stays in that community and doesn't spread like it has. But an example is the Liberian American man who traveled to Lagos, Nigeria, and had Ebola, and now 5 of the medical workers who treated him are now said to be infected.
So the passing of the disease, we've talked a lot about this. I mean, people are becoming more and more aware of it. But it's not an airborne virus. You have to contract it through some sort of bodily fluids.
Right,
so
sweat.
Handshakes.
Yes.
You wouldn't shake hands with somebody normally now. They're telling people not to do that.
Right, and that in some of the countries like Liberia, it's very common to shake hands. And so now they're telling people no handshakes because it doesn't, if I coughed, you wouldn't get it. But it does spread through sweat, saliva, blood, and people who are most at risk are those who are attending to dying patients.
Well, now, we have these 2 Americans that have arrived here in the United States, the doctor and the missionary. They've been flown here from Africa, and they've obviously made the headlines there. But tell us more about what's going on with their treatment and what's going on with them.
One of the things that people say is there really is no treatment for Ebola. However, you can treat the symptoms, and people are learning that your odds of surviving are far better if you get into treatment early. Both of these Americans were treated early because the doctor, first of all, recognized that he had Ebola symptoms, and he isolated himself. And you can treat dehydration because Ebola, you vomit a lot, you have diarrhea, you lose fluids. You can treat that.
So they're treating symptoms.
Yes,
Okay.
You can keep fevers down. You can give pain relievers for the pain. You can treat the symptoms and keep fluids up and everything while the body heals itself.
So you're helping really the body fight this disease. Okay.
But
now,
it's not like a flu shot, a flu vaccine that can prevent you from getting the flu.
Right, okay, so there is no vaccine. However, there is some serum we've been hearing about. What is that about? What's with the serum?
There are 5 promising vaccines in the works, some in the United States, some elsewhere. And there are also some forms of treatment that people have been working on. I spoke to a scientist recently who's working on 2 forms of treatment and a vaccine. And what he says is that what they imagine will happen, one of these vaccines will be starting out with human trials. He figures it'll be more like HIV/AIDS, where you have a combination of treatments to help thwart the virus.
Okay, well, it'll be interesting to see where they go with that. But I guess a lot of people die just from the flu, to sort of keep things in perspective, right?
57,000 people.
Right, okay, and so we're looking at the Ebola virus where the numbers are not there yet. But
yes, and H1N1 had a much higher, it was a pandemic,
right.
Flu pandemic, and it had much higher fatality rate than Ebola has had so far.
Okay, it sort of keeps it in perspective at least, okay. VOA health reporter Carol Pearson, thanks a lot for joining us.
Welcome.
Glad to have you on the show.